In this video, I'm going to show you how to quickly get rid of hip pain from side sleeping. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. If you're a side sleeper like me, I'm sure that you get hip pain from time to time, and you also wonder, why does this keep happening? The quick answer is you probably have weakness in the muscles that support the legs, the hips, and the back. Weakness that allows tension and tightness to build while you sleep, leading to pain. So in this video, I want to go over easy daily exercises that are going to build strength and stability and hopefully get rid of hip pain for good while you sleep. All of these exercises can be done in bed, require no equipment, and you may find give quick pain relief, even in as little as 30 seconds. So you can do these in the middle of the night if you would like. So let's get started and fix that hip pain while you sleep right now. This first exercise is what I call the outer hip arc. It's really good for side sleepers that tend to have more of their hip pain on the outside. What I'm going to do is start off in bed. This one is most comfortable to do in bed, but you can do it on a floor. I'm going to have the painful side up towards the ceiling. I'm going to rest my head right on my hand like this, or you can use a pillow. So start off with your knees bent roughly at 90 degrees and start off in the position that most mimics your side sleeping position. So for me, since I'm a side sleeper, it's about right here. From here, what I'm going to do is then take my foot on the top side right here, bring the ankle back into flexion, so bringing it back like this, and then turning my foot slightly inwards. From there, I'm going to keep my leg, the top leg here, in line with the bottom leg, and then slowly raise that leg upward towards the ceiling as much as we can. It's kind of like a clamshell. What you should really feel is an activation around the glutes and the outside of the hip. Really focus on feeling that. If you're not, try to really focus on bringing that foot back and inward just a little bit, and it should isolate that hip. But I try to hold this one for about 5 seconds. From there, I just relax and slowly come back down. And then I'm going to repeat this one 10 to 15 times. If you want more of a challenge, you can throw in another set or two. To make this one even more challenging, instead of keeping this knee bent, let's straighten the leg out like this. We're going to bring the foot towards us and then in slightly. We're going to keep this top leg in line with the bottom and then just slowly raise it up like this. And it really starts to fire on the outside of the hip right here. So next, what I'm going to do is then build into an arc. So I'm going to take this bottom leg and slightly bring it up towards me just a little bit. And then from there, I'm going to repeat this process. What you're going to notice is it hits the hip just a little bit differently. So what you want to do is pretty much go in a complete arc from your normal sleeping position to going all the way up as much as you can. You're going to notice that one certain spot, like let's say that this angle right here really hits my hip the most. I really just feel the muscles firing. I stop at that point and then focus on that by throwing more repetitions in. Always focus on the spots that need it the most. And I do recommend that when you're done on one side, even if the other side doesn't hurt, to do it on that one too, just to keep everything in balance. So here's how we can target inner hip pain, which tends to be caused by weak inner thigh muscles known as adductors. This one is called the inner hip arc. This time around, we're going to have our painful side on the bottom. I'm just going to lay it on that side. The non-painful side, I'm going to keep that knee bent and then just upwards towards the ceiling. Foot is kept flat. You can also support your head with your hand again, just like this. We want our whole body in a nice straight line from our back all the way down to our toes. I'm going to start off by taking the non-painful side, bringing my foot over the bottom side just like this. What I'm going to do from here is take the foot on the bottom side and then bring my toes back towards me, putting my foot into flexion. The movement is very easy. We're going to keep our legs straight at the knee. Treat it like kind of like a pole. And from there, I'm just going to slowly raise my leg upwards towards the ceiling as much as I can. The more that we go up, the more that you're going to feel the muscles in the inner part of the thigh start to fire. Really focus on feeling that. Hold this one for about 5 seconds. You're just going to come down, relax, take a breather. You want to repeat this 10 to 15 times. And if you want to make it more challenging, you can throw in another set or two. But let's build into our arc and focus on spots that need it just a little bit more. So I'm going to take the top leg and bring it backward like this over the other leg, the bottom leg. From here, I'm going to just slowly take my leg outward just a little bit to start to create that arc. I'm going to repeat this process. When you do this, you're going to notice that the muscles get hit just a little bit differently, including around the hip. So you want to do that a couple times, and then you're just going to build into it even more. Do this whole process going straight away from you and build into it as much as you can. If you do notice that one certain angle, like let's say right here for me, just targets that inner thigh, that inner hip just a little bit more, I try to stop right over that spot and then throw in about 10 to 15 repetitions. Again, always focus on the spots that need it the most. And if you want to make it a little bit more challenging, you can throw in another set or two. But when you're done on one side, switch to the other to keep them both in balance. So here's a great daily exercise that's going to strengthen and lengthen everything that supports the back and hips. You could do this one in bed or on a floor. We're going to start off with the strengthening exercises. Start off on all fours just like this. The first part is called the bird dog. Very easy to do, and I'm going to custom tailor it a little bit to hit the hip just a little bit more. So this is how I like to focus on pinpointing the hip. I'm going to just take one leg back like this while keeping my foot on the floor or the bed. Just kind of slide it back and reach out with your toes until you feel an activation of the calf muscles going into the back of the leg, the hamstrings going into the hip, and then into the glutes. Once we feel that, we're going to slowly raise the leg up and just have it pointing straight away from us, reaching out with our toes the whole time. You should feel the pelvic muscles firing, the hip, and also the core muscles right here. I try to hold this one for about 5 seconds. From there, I just relax, come back down. From there, I'm going to take that side and then raise it up, keeping my knee bent at 90 degrees. We're going to do a movement called the fire hydrant, and you're going to see for good reason why it's called that. So I'm going to raise that knee up just a little bit, and then from there, I'm going to rotate my leg and body upwards towards the ceiling. That's a nice fluid motion. The more that you go up, the more that you're going to feel a very good activation into the hip. Hold this for about 5 seconds. From there, you're just going to come down, take a breather, and then I'm going to repeat this on the other side. You want to do this one nice and slowly for about 10 to 15 repetitions on both sides. And with each repetition, try to build into it just a little bit more. Really challenge those muscles. If you feel like you have a little bit more energy, you can do another set or two. Next, we're going to build a little bit more into mobility to help stretch everything out. We're going to do what is known as a frog rocker. So again, I'm going to start on all fours. I'm going to put my feet together and then slide my knees outward as much as we can until you feel a very good stretch in the inner part of the legs and also going on into the hips. Once we feel that, I'm going to tuck my chin towards my chest and then rock my whole body backwards, kind of like taking my butt down towards my heels. You really want to focus on feeling it into the legs and hips. Once we feel a very deep, comfortable stretch, we're going to hold this one for 20 to 30 seconds. Do nice, slow, controlled breathing too. Just let that tension out. From there, I'm going to rock forward with my whole body. This right here is going to hit the hip flexors. You'll feel a very deep stretch in the front part of the leg. The hip flexors are a big instigator of back pain and also hip pain. Again, hold this one for about 20 to 30 seconds, and then we're just going to relax, take a breather. On the next repetition, try to stretch into it even more. Do this for 3 to 5 times. To take this one to the next level, instead of going straight forward with it, tilt your body in one direction. Whatever way that you're tilting, you're going to feel it open up a little bit more on the opposite side. So I'm tilting towards the left, I really feel it off to my right side. Again, I just hold this one for about 20 to 30 seconds and then rock forward. Experiment with different angles. Go all the way towards the left, go all the way towards the right. If one feels like it's hitting the hips just a little bit better, at that point, make a note, stop right there, throw more repetitions in. One of my absolute favorite exercises for the legs, the hips, and the back is the pelvic bridge because it works so much in such a little amount of time. But I'm going to modify the bridge to hit the hips just a little bit more. You can do this one in bed or on a floor. Just lie flat on your back like this. Our knees are going to be bent. Our legs are going to be roughly about hip width apart, my feet flat. I'm going to take my hands and I'm going to place them right on my hips. Let's start off with the basic glute bridge. I'm going to focus on driving my hips up towards the ceiling until I feel I have a nice straight line from my knees to my hips to my shoulders. If you're unable to get into this position, let's say you can only raise it up a little bit, focus over time on building strength and flexibility to be able to get into this position. But we should feel the core muscles activate, the lower back, the legs, everything around the hips. Really focus on feeling that. I try to hold this one for about 5 seconds. From there, I just relax, take a breather, and then slowly repeat this one 10 to 15 times. If you want to make it more challenging, you can throw in another set or two, but just always focus on engaging those muscles as much as you can. How to take this one to the next level and focus a little bit more on a hip, what I'm going to do is a hip march. So let's get back into that basic bridge right here, but I'm going to lift one leg up, kind of marching my knee back towards me, knee to the chest right here, and this becomes a lot more challenging. Try to hold this one for about 3 to 5 seconds. You're just going to relax, take a breather, and then repeat it on the other side. Try to do this one for about 10 to 15 reps on both sides. You can make it harder too by, instead of keeping the knee bent, by going straight out with it. You'll really feel the core right here engage. But give that one a try too if you want to take that one to even the next level. So if you deal with a little bit more pain in the inner part of the leg or towards the groin while you sleep, this is how you can modify the bridge to target that. What I'm going to do this time around is put my feet, my knees, and pretty much my whole legs together. And then I'm going to repeat this bridge. Instead, this time around, you'll notice a lot more firing in the inner part of the legs and the inner hip. Hold this one for 5 seconds, relax, take a breather, and then try to repeat this one 10 to 15 times. And if you feel like you have a little bit more, you can throw in another set or two. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.